She talked about the fact that there were ways in which women could plan for their families and prevent pregnancy without using synthetic hormones or long-acting reversible, injectable devices. And I was like, what are these things that you're talking about? What are these methods? And she told me about natural or fertility awareness-based methods. And that was the first time I ever heard about these methods. And I think my reaction that I had is probably similar to the reaction that most women have when they hear about these methods. It's one of shock. How have I never heard this before? This is unbelievable. Quickly turned to anger. Why has nobody ever told me this? Why didn't my doctor tell me? Why didn't I learn about this in sex ed in high school? So I think like a lot of people, I had a very similar, reaction. And that was, over 20 years ago. But ultimately, that led me a decade later in 2010 to starting FACTS About Fertility.
Welcome to the Truth and Fertility podcast. I'm Haley Yeager. Today, I am sitting down with Dr. Marguerite Duane. This woman, you guys, is a Wonder Woman. She is a woman of all trades. I am so honored to be sitting down to chat with her today. We're going to be talking about her organization that she co-founded, FACTS About Fertility. We're going to be talking about a conference coming up that I will be going to, and I hope many of you will as well, because it's just such good things are offered there. And we're just going to be talking about overall health and fertility, why those are connected, why that's all important. And you know what? I'm going to stop talking now to just let Dr. Duane introduce herself and just give us all the gold. So welcome.
Thank you so much, Haley. It's really just a joy to be with you again. And we're really looking forward to getting to be with you in person again at our conference. I know we had the pleasure of, really getting to know you and meeting you last year in Florida when we hosted our most recent FACTS speaker training. And so grateful that you are one of our FACTS speakers, helping us to share the facts about fertility with medical students and nursing students and health professionals and patients and everyone who really needs to hear the truth about fertility and the way the female cycle is designed to function. So yeah, it's really just an honor to be with you again tonight. So thank you for the invitation to join.
Absolutely. Well, why don't you go ahead and introduce yourself, introduce your work of FACTS?
Sure. So like you said, my name is Dr. Marguerite Duane, and first and foremost, my most important roles are as a wife and a mother, and I am just incredibly blessed to have 4 amazing children that really inspire me in my work and what I do and really motivate me because I want every person to be able to experience, the joy and the gift of children if that's what they so desire. And my next most important role is my role as a family physician. And as a board certified family physician, I like to say we care for patients from cradle to grave, from womb to tomb. I really like to say I care for patients from lust to dust because of the work that I do in caring for couples with infertility and who are trying to get pregnant. And it's really just a joy to be able to work as a family physician. And, in fact, what motivated me, what really inspired me to pursue medicine the day that I received my call, if you will, to be a doctor when I was just 8 years old. And I was sitting at my mother's feet and watched my baby sister being born into this world. And for anybody that has witnessed childbirth, it is just transformational. And that experience when I was just 8 years old really set the stage. And I knew I wanted to be a doctor and I wanted to care for women and men and children and, provide prenatal care. And it was funny because my mom had my baby sister at home. And now, 40 plus years later, I have a full spectrum family medicine practice where I care for patients of all ages. And through my training in fertility awareness and really restorative and authentic ways to address reproductive health care, I'm able to help couples have children. And with my medical practice, MD for Life, we do this all in the home. I have an entirely house calls based practice, but yeah, so that's a lot of what I do. But I'm delighted to be here today to talk about the work that I do at FACTS. And like that day when I saw my baby sister being born, I had a similar experience that really motivated and inspired my work of FACTS. And this is when I was in my first year of my family medicine residency training. I was on OB call one night doing what any good interned at an OB call, like getting all of my postpartum patients ready for discharge, writing prescriptions for birth control pills. And I had a senior resident, Dr. Pearl Huang Ramirez, who, first told me about, we were talking about the different family planning options and how they work and how they can affect the female cycle and affect breastfeeding in that postpartum period. She talked about the fact that there were ways in which women could plan for their families and prevent pregnancy without using synthetic hormones or long-acting reversible, injectable devices. And I was like, what are these things that you're talking about? What are these methods? And she told me about natural or fertility awareness-based methods. And that was the first time I ever heard about these methods. And I think my reaction that I had is probably similar to the reaction that most women have when they hear about these methods. It's one of like shock, like, how have I never heard this before? Like, this is unbelievable. Quickly turned to anger, like, why has nobody ever told me this? Why didn't my doctor tell me? Why didn't I learn about this in sex ed in high school? And, so I think like a lot of people, I had a very similar, reaction. And that was, over 20 years ago. But ultimately, that led me a decade later in 2010 to starting Facts About Fertility. So, like you said, I co-founded the organization with a fellow family doctor, Dr. Bob Motley, and FACTS originally stood for the Fertility Appreciation Collaborative to Teach the Science. And I am so proud of our name, and I think it really reflects what we do and what we're all about, right? We want people to not merely be aware of their fertility, but really to understand it and develop a healthy respect, hence the fertility appreciation and collaboration. It's the Fertility Awareness Appreciation Collaborative. We're all about working with others, whether it's, myself as a family physician, working with my OBGYN colleagues, working with midwifery colleagues, working with people that are trained in and teach different methods. Personally, I'm trained as a NAPRO medical consultant, a FEM medical consultant, and a neofertility medical consultant. But we work with people that are trained on all of the different methods, and we work with all of these people to teach the science. That's what FACTS is all about, sharing the facts about fertility, teaching the science underlying the female cycle, and how when women learn to chart, it can serve as a vital sign of health. So we do this through lots of different avenues. We do this through our medical school elective that really is our flagship program. It's what inspired the work of FACTS. But now we do this through online continuing medical education courses for physicians or nurse practitioners or midwives who are already in practice. We do this through an elective for residents. And later this year, I'm super excited to announce that we are going to be launching a fellowship, the first of its kind fellowship. We're calling it the FACTS Firm Fellowship for Fertility, Integrative, and Restorative Medical Care. So we're so excited about that. But what I'm really excited about today and, in the upcoming weeks is getting ready for our annual in-person conference in 2026. We're going to be holding our FACTS conference in Peoria, Illinois from April 9th to 11th. And we just have an amazing lineup of speakers. And I know nearly 100 people, planning to come already. So we definitely have room for more and would love to be able to talk more about that and, answer questions that you may have.
That's also amazing. And honestly, when I was kind of starting my journey and open, like the doors were just open wide to learn about fertility awareness-based methods and charting the cycle and understanding how that plays such a huge role in restoratively healing women and rather than placing a bandaid on them or XYZ. FACTS was one of the first places that I learned about, and it is such an amazing resource. And this organization you founded is just so phenomenal and really one of the game changers in this realm of restorative reproductive medicine. So I'm so grateful for all the work that you've done. I've learned so much from you and everybody, and all of the content that FACTS comes out with, and it's really amazing. I am curious though, going back a little bit in your story. So you talked about how when you were, I think you said first year residency, that
Mhm.
you had just learned about any sort
Mhm.
of fertility charting, fertility
Yep.
awareness-based method. What was the trajectory then from just having first learned it to then all of a sudden you're creating a nonprofit to teach other
Yeah.
people about it? Like, where was the connection between the two?
Yeah, so I mean, I think right away, like I said, that shock and that anger, like why didn't I learn about this in medical school? Like this seems like basic women's health education, I thought. And then I'm like, why didn't I learn about this in college when like most college students, I presented to the student health center with concerns about my cycle, and the only treatment that was offered was birth control pills. And I didn't have a need for that, but this was what I was told was the best option for my painful periods. So without any other information, without the doctors offering me anything else, that's what I chose, only to suffer from the side effects like again, so many women experience. And so I stopped using them, but you know, was never offered anything else. And so as I'm thinking back, I didn't learn about it in medical school. I didn't learn about it in college when I was in need of better care for my cycles. And I didn't learn about it when I was an adolescent going through puberty, right? This should be basic body literacy education. And, I'll just say this now, in addition to the work that I do with FACTS, it's been incredible because now it's given me the opportunity to bring this information to medical schools. And I've joined the faculty at Duquesne University, where I lead their Center for Fertility Awareness Education and Research. And we are getting ready next week to roll out a curriculum called the ABLE Project, Advancing Body Literacy Education. So I'm collaborating with Katie Vidmar with her work, but there's so much. So, that night on call, as I thought back, like, why wasn't I offered any other option? So my next step was then, how do you actually do these methods? So I got connected with a local instructor. I learned to chart for myself. It was really incredibly instrumental in helping me address my own cycle related issues. And then, a few years later, when I was, engaged, my husband and I learned, or my soon to be husband and I learned about using these methods from a family planning perspective. And I thought to myself, like, yeah, this is great that they're wonderful family planning methods. And, you know, fertility awareness based methods are oftentimes referred to as natural family planning. And at FACTS, we use those words interchangeably. They really can be used interchangeably. Um, what I like to say about these methods is they're true methods of family planning, right? Methods that you can use to achieve pregnancy or to prevent pregnancy, right? To plan your family depending on your goals. Um, but the reality is that when we learn to chart the cycle, it's so much more than just a method of family planning. It's a way of health monitoring, right? It's a way of using the female cycle chart as a vital sign, as a diagnostic tool to aid in the workup and the treatment of a wide range of women's health conditions. So, you know, once I started learning it for myself and implementing it in my own life, I started using it with my patients. And it was amazing when I was able to help couples and women really address their issues. So it took me about 7 or 8 years before I explored and I discovered the Creighton model. And at that time, it was the only model that offered formal training for physicians to learn the medical applications. So I trained in Creighton, which was incredible, in 2008. And then in 2010, I was on faculty at Georgetown University School of Medicine. And one of my colleagues had reached out to say, hey, we're looking for volunteers to teach small group classes to first year medical students on any topic related to medicine and healthcare. And I was familiar with this. I had actually taught a course on breastfeeding and the basics of breastfeeding. Again, a topic really important for women's health, for the health of our children, not something we're well versed in as physicians or healthcare professionals. Um, and I thought to myself, when my colleague had reached out to say, hey, would anybody willing? I thought this would be an incredible opportunity, even to teach just a small group of medical students about these methods and how they work, right? Right from the beginning in their first and second year med school. And so I did teach this course, and the feedback from the students was so overwhelmingly positive. They were like, this is basic women's health information. This is the most clinically relevant information I've learned. Like, this is something every medical student should learn. And it was really that statement that motivated me, that said, we need to teach this to every medical student. How do we make this more widely available? At the time, I was on the board of a larger medical education organization, the Family Medicine Education Consortium, and I spoke with the CEO about this idea of like starting this project, the FACTS project, the Fertility Appreciation Collaborative to teach the science. And the rest, if you will, is history. So I've been around from the beginning with my colleague, Dr. Bob Motley, and our team has grown exponentially. And when people comment like, how do you do everything that you do? I'm like, I have an incredible team of people, like an amazing director of education, Natalia Rodriguez. Our conference team, Emily and Paula, are doing an amazing job pulling together this conference for Peoria. Dr. Tucker Brown is our director of development. And now we have Cindy Cass, who's heading up our FACTS Match program, really working to match medical professionals with practice opportunities that will really allow them to offer and provide what we like to refer to now as cooperative hormonal and restorative reproductive medical services, because it's more than just reproduction. It really is about hormonal health as well. So, if you will, CHARM, cooperative hormonal and restorative medical services. So it's so much broader, right? And that's what we're really hoping to focus on at our upcoming conference in Peoria, with the theme Facts for Restoring Reproductive and Whole Body Health, right? There's so much more than just using these methods from a family planning perspective or to help couples to have babies. It's about really, cooperating with our bodies and restoring our health.
Yeah, and that's actually the topic that I really want to get into with you today is because, when you talk about your fertility, you talk about your reproductive system, you talk about estrogen, progesterone, you talk about all the hormones and everything, it's not in a vacuum. Like your reproductive system
Exactly.
is not in a vacuum. It doesn't just affect
Yeah.
things with your fertility, it affects your whole body. So I want you to unpack that. So how does, let's say you have some sort of hormonal, just for example, throwing it out, you have a hormonal deficiency in progesterone or something like that,
Mhm.
right? And that's affecting your cycle. Maybe it's causing some PMS symptoms, but how does that, or any other example, I'm just throwing something
Yeah.
out, but how does something like that with your reproductive system affect the wider body, affect your
Yeah.
overall health?
Yeah, absolutely. Great question. This is why I love being a family physician, because as a family physician, we look at the person as a whole. And the reality is that there is no one system in the body that works completely independently of any other system, right? I mean, our cardiopulmonary system, right, works together. So many aspects of our health are fully integrated. What's really unique about the reproductive system, though, is while it does affect every aspect of our health, the reproductive system is the only system in the body that, to function to its fullest potential, requires cooperation with another human being, right? The reality is, as women, we cannot reproduce on our own. It really requires full cooperation with another human person. But when we talk about reproductive health, and we, in particular, looking at women and men too, you know, our reproductive health is determined by our hormones. And it really is an intricate interplay or orchestration, if you will, of hormones that begins in the brain, right? So yes, progesterone is important and estradiol are both important, but they're downstream from some of the hormones that begin in the brain. But what's amazing is that these hormones that are produced in the ovaries can absolutely affect the brain and our mental health. So, you use the example of progesterone. Progesterone plays a critical role in mental health. It really serves as an anxiolytic, really helping a person to be calm. Um, when our progesterone levels fall too rapidly, which we can sometimes see in PMS, this can lead to an increase in irritability, an increase in anxiety, an increase in depression because we don't have enough progesterone. And while people might think, oh, if I don't have enough progesterone, like for example, a lot of times with PMS, it's recommended that you put women on birth control. Well, hormonal birth control doesn't actually replace the hormones. It suppresses the woman's normal hormones using synthetic estrogens and progestins, but those synthetic progestins do not cross the blood-brain barrier. So it does not have the same effect that bioidentical progesterone does. So it is so, so important. But even hormones that we wouldn't think of as being reproductive health hormones, like thyroid hormone, for example, classic example of a hormone that if it is out of balance, it will have significant impact on women's health. And that's why at our conference in Peoria, Illinois, our first presentation will be by Teresa Kenny on autoimmune thyroid disease, because this is something we see so commonly in women. And the reality is in women with thyroid disease, the one blood test that we use as a screening test in most people when we check thyroid is called the thyroid stimulating hormone, or TSH. Now, the normal quote unquote range for TSH levels is between 0.5 and 4.5. But research has shown that in women with a TSH greater than 2.5, which is in the middle of that 0.5 to 4.5 range, women with a TSH greater than 2.5 have statistically significant increased rates of infertility and miscarriage, right? So thyroid is so important. And, even when it doesn't come to family planning, women who have hypothyroidism, where they're not making enough thyroid hormone, it will cause irregularities in her cycle. It may also cause an increase in depression. It may also affect, just her temperature regulation. It can affect her hair and her skin, and it can impact her bowel movements. There's so many ways, but thyroid hormone will absolutely affect a woman's overall reproductive health and cycle health. Another one of our talks, which I'm really excited about, is a talk on by Dr. Paul Hrues. He'll be speaking at our conference. He is he's a pediatric endocrinologist, and he's talking about a very unfortunately common condition that's not really well known or addressed, but hypogonadotropic hypogonadism. And what that means is basically when the gonads, which in women are the ovaries, and men, the gonads are the testes, when they're not producing the hormones that they're supposed to, how this can lead to prolonged periods of women not getting their period, right? Prolonged periods of amenorrhea, if you will. And again, progesterone, which is the pregnancy hormone progestation, it's produced when a woman ovulates. And yes, it's important for reproductive health. It's important for mental health, as I just discussed, but it's also important for bone health. So women who are suffering from conditions that can cause anovulation, for prolonged periods of time, this can have adverse effects on their bone health as well. If they're not able to produce estradiol, whether they're, maybe they have functional hypothalamic amenorrhea as an example, and their body isn't producing estradiol. Maybe they're going through perimenopause and their body isn't producing estradiol. Estradiol has important implications on mental health, but also on heart health. It also affects our energy level and our cognitive function. So our hormones play such a critical role. And that's why for our conference, the first morning on Friday morning, we're going to be focusing on all endocrine issues. It's a hormonal health morning, if you will, so we can really focus on, again, that cooperative hormonal health care.
Yeah, as you were talking, an example of when I was working with a client, I was teaching her the Creighton model. An example came to mind of her. She asked me a question, and it was such a good question. And I wanted to bring it up to you just to see what you would say, because I was kind of at a loss for words when she asked it. This specific client, I don't know if she was ever formally diagnosed with PCOS, but it was the more or less the thing where you look at her chart and you're like, yeah, this is most likely what's going on. Very long cycles, a lot of the typical PCOS symptoms that you would think of, and but she's never necessarily struggled to get pregnant. She does ovulate, just not as regularly as we would like to see.
And I think that's an important point, because a lot of women with PCOS will still ovulate, but a lot of people say like, oh, if you have PCOS, you're going to have trouble getting pregnant. And while that may be true, PCOS is one of the leading causes of infertility. Women absolutely do still ovulate with PCOS. They just tend to ovulate much later in the cycle. So,
Yeah. Yeah, exactly. And that was exactly what was happening with this client. And so I was urging her to go see a doctor trained in either NAPRO because she was starting with Creighton or some sort of restorative reproductive medicine to kind of work through this because now that I'm remembering, I think she had received a diagnosis of PCOS in the past, but she hadn't really done much to work it out or
mhm,
to really do anything about it. And I was chatting with her about this and I was kind of urging her like, "Hey, yeah, this is actually not normal. Like this is something
right.
that I really encourage you to go see a doctor for." And she was her question was very good. And she was like, "You know what, Haley, I hear you. I hear everything that you're saying, but I've never really struggled to get pregnant. I'm kind of used to having these long cycles at this point. Why should I care?" That was her final question was, "Why should I care? Like why should I put so much like start on this journey, put so much effort and energy into finding a good doctor and doing what they tell me and getting blood work done after blood work and changing my nutrition and blah 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 blah. Why should I care?" So what would you say
Yeah.
to her?
I love that question. First of all, it's a
Yeah.
great
Yeah.
question. And again, I think it gets back to what is this all about? Well, yes, having a child is a great goal and a great gift. And it sounds like that was something that she never struggled with. When I have patients present to me, I'll answer this with another example of a patient of mine that had PCOS, right? But she came to me because she was dealing with secondary infertility. When any patient comes to me struggling with infertility, I tell them, my goal is not to help you get pregnant. And they're like, wait, but I'm coming to you because I'm struggling with infertility. And that's your goal isn't to help me get pregnant. I'm like, no, my goal is to optimize your health. Because if we optimize your health, then your body will do what it's designed to do and you will get pregnant, right? You know, God willing, right? There's so many factors that can go into it, but, hopefully couples will still conceive. And so with PCOS, it's a multifactorial, right? Like there are, we oftentimes think of it as just a hormonal health issue related to the ovaries, right? Like it's the name, polycystic ovaries. And in fact, the standard of care is if a woman is not trying to get pregnant, to just put her on hormonal birth control. And if she is trying to get pregnant, sometimes they'll use metformin. Why do they use metformin? Well, fundamentally, PCOS is not a reproductive health issue. It's a metabolic issue. And one of the most common issues with PCOS is insulin resistance, right? And insulin resistance affects fertility because it causes ovulatory dysfunction, right? So maybe women are not ovulating on a regular basis. But insulin resistance can also negatively affect cardiac health or heart health, right? Ultimately, insulin resistance can lead to diabetes, which can affect your kidneys. It can affect your vision, can affect your nervous system. There are so many factors that can be affected by uncontrolled or poorly controlled PCOS, right? So again, using the example of the patient that presented to me with a history of PCOS, and she, at our very first visit, she had uploaded into the portal pictures that she had had on a laparoscopy that showed her ovaries, and they were just full of cysts. I'm like, anybody looking at this would see this as PCOS. And she had secondary infertility. And she did follow a very healthy diet to help improve her insulin resistance. And we had her on metformin and myo-inositol. And we were doing everything we could to optimize her health. Ultimately, after a year of optimizing her health, doing ovulation induction, she still didn't get pregnant. I said, you know what? The reality is with PCOS, you have all of these tiny cysts, and I could see them on her laparoscopy. They're all producing estradiol, and it can throw off the overall hormonal balance. So another option, although it's less used currently, but another option to treat PCOS is a surgery called an ovarian wedge resection. And the way to think of an ovarian wedge resection is if you've ever played Trivial Pursuit and you've got the little round game piece with all the little pieces of the pie. With an ovarian wedge resection, it's like you're taking out a piece of that pie, a piece of the ovary with a lot of those follicles. And oftentimes that will help to reset the woman's hormones. So after having optimized my patient's cycles for a year with no success in having pregnancy. I did talk to her about, the potential need for an ovarian wedge resection. And this was in the middle of the pandemic, so it was a tough time, for doing elective surgeries, if you will. But she thought about it and she talked about it with her husband. And ultimately they decided they did have one child. And she said, even if I don't get pregnant, even if I never have another child, ultimately, I want to be healthy for the child that I have. I don't want to have a heart attack at 50 because I've had poorly controlled PCOS and insulin resistance that's going to affect me. So she ultimately decided to do the ovarian wedge resection. And I'll never forget, she had the surgery in September. She got her period in October and she was pregnant in November, which was incredible. And
That's
she went on to
amazing.
have a healthy baby boy, which was so exciting. Nursed him, no issues, was doing really well. After that, we had that family planning conversation. Where are you at? You have a girl and a boy. And she's like, we're open to having more children, but we're actually thinking we might want to adopt. So I think right now we're probably going to postpone while we look into that. I'm like, that's great. Keep doing what you're doing in terms of your health. If there's anything I can do, great, no problem. 2 months later, she messaged me. She's like, I had a positive pregnancy test. I was like, congratulations. She's like, I don't know how that happened. I was like, really?
Really?
And she said, they actually were not trying. And in fact, they were using, she's like, we were using protection. I'm like, it doesn't always protect when you use it during the fertile window. But she was stunned. And I was like, we restored your reproductive system to function the way that it's designed to function. And lo and behold, it did. You were able to reproduce. But the short answer to that was the long version to your answer to your question. But the short answer is, to that woman, I would say, treating PCOS is not solely for the purposes of reproduction, right? It's for improving overall health. So that's why I would say it's probably still worth it. And sometimes, I had another patient with PCOS who had 50 to 60 day cycles. She wasn't very overweight by any stretch of the imagination, but even a 5 to 10 pound weight loss can have a significant impact. And she lost 5 pounds and her cycles went from 50 to 60 days to 35 to 40 days. So she was still longer than normal, but she was much healthier and she was able to conceive. And because she was charting, we could see that she ovulated around day 27. So we could much more accurately time her pregnancy based on her charting. Again, the chart is such a valuable tool, but I'm really excited because this year our conference is being hosted by OSF in Peoria, Illinois. People keep asking, why Peoria? Well, OSF is there and they're hosting us. And one of their OBGYN physicians who just completed the NAPRO fellowship a couple years ago is actually going to be giving a presentation on PCOS and the role of ovarian wedge resection. So for people that want to learn more about this from a clinical perspective, especially, surgeons, OBGYNs, even, family doctors and midwives, there will be a lot to learn. So our afternoon session on Friday afternoon is really going to focus on those surgical topics, including PCOS.
I'm very intrigued by especially the ovarian wedge resection, because I've now have experience working at a pro-life OBGYN clinic as kind of their on-site Creighton instructor. And I saw women after women who came in with PCOS. I taught her how to chart. She was working with the surgeon at this clinic and she got the ovarian wedge resection, came back. Her charts it was night and day. I mean, it was just phenomenal how it really helped regulate her cycle. And
So, Haley, we need to start collecting that. Haley, we really need to start collecting that data. It's so important because ovarian wedge resection was very popular in the 1960s and 70s. And then the reality is when IVF really took off, people stopped doing those. And in the 1970s, it was an open procedure, but the risks were greater, adhesions were greater. There were so many more complications. The way they do ovarian wedge resections now is very, very different, right? And so I think the success rates would be much, much better. But I mean, I would love to connect with you and your surgeon and, even to do a case report or a case series report to look at the impact of an ovarian wedge resection on the chart. And it really gets down to the procedure and the technique with the surgery. And another one of the surgeons that will be speaking at our conference is Dr. Patrick Young, and he is the leading endometriosis surgeon, I dare say, in the country, if not the world. And his approach to surgical treatment of endometriosis, it's thorough, it's comprehensive, it's detailed, it's careful. I mean, it's so important to use precaution to prevent adhesions. And he does an incredible job. And his talks are phenomenal. So we're really excited to be able to welcome him back, which is going to be awesome.
Yeah. To go down this rabbit hole just a little farther, what I'm curious too about is going back to the example you gave of this patient you had that, you took a year of, here's the trash. Guys, we're dealing with some trash can rolling outside. So if you hear something in the background, that's what that is. Anyhow, you were saying that this patient, she was working with you for a year to optimize her health, to optimize her hormones, to get to a point where she was hopefully ovulating more regularly. But it got to a point where she still wasn't getting pregnant. And then we needed to have some sort of surgical,
Mhm.
a surgical fix for that. What do you think the reason is that some women are especially with PCOS going on this specific example, do need to go into surgery at some point because just other things aren't cutting it, or some women never really do, and they're able to optimize their cycles with metformin or with, what have you, whatever medication or diet, whatever they have. What do you think is there a difference there?
Yeah, that's a great question. I mean, certainly with PCOS, there are a lot more non-surgical options to be able to employ to treat, um, to more effectively treat PCOS. Why this woman, needed it, I'm not sure. I just felt like as a family physician, even though I'm trained in the leading major restorative approaches to reproductive health care, I felt like I had done everything that I could within my ability. And I knew that this was another option. I said, let's consider this. Again, she had had a surgery earlier, and I was able to see the image, and I'm like, if you have all those little cysts, like, it may be, who knows, it may or may not help. With endometriosis, it's a little different. Many women can conceive without surgery with endometriosis, but endometriosis, I have found, more often than not, patients do need the surgery, in part because we need the surgery to make the diagnosis of endometriosis, right? Like, it is a surgical diagnosis. But once we can treat it, it can be literally life changing. And again, I will refer many of my own patients to Dr. Young, and he and I have an incredible success rate. Literally every single one of my infertility patients that I've sent to him for surgery has conceived within 6 months. And these are patients that have been trying for years. In fact, just recently, one of my patients gave birth to a baby boy. I had started seeing her in December of 2024. And at that time, she was 40 years old. She had done IVF for 5 years because she was told it was the only way she would get pregnant. She had one child through IVF, but had 8 more embryos that she was not able to carry to term, and was being told she needed to do more egg retrieval and create more embryos. And so she came to me, and I saw her, and she had a multitude of factors. She had insulin resistance issues. She had a history of endometriosis. I worked on optimizing and treating the underlying insulin resistance. I referred her to Dr. Young. She had surgery, and literally a month later, she was pregnant. And when I did her ultrasound, she held up the photo. She's like, "Dr. Duane, I was told this would never happen naturally." And I'm like,
Wow.
I don't know what to tell you. I mean, like, the
Yeah.
reality is that if we treat the underlying issues, we might really actually be able to affect health. Next week on Wednesday, I've been invited to present a poster um, about the research on my own practice. There's a conference, the Health and Human Services is holding their inaugural Women's Health Conference, and they've invited me to present a poster on my patient data. I have a very small very small family practice. Like I run FACTS full time. And did I mention I teach at Duquesne University half time? So like I don't have a
That's
lot
why I
of time
called you
left.
Wonder Woman.
I don't have a lot of time left in my day to see patients, but in the last 3 years, in my family medicine practice, I've had 40 women come to me who've either had infertility, miscarriage, or both. And of those 40 women, 35 have conceived. So my conception rate is 84%. And now, 3 years out, my live birth rate is over 70%, right? And these are women in their late 30s and early 40s. Now, do most of them get pregnant within the first 6 months? No. Oftentimes, because it's multifactorial, there's lots of issues. We need to treat a lot of those issues. And again, some of these issues are things that I can't treat, right? Like tubal factor infertility, when the tubes are blocked. I just had a patient recently that I saw who had, bilateral tubal blockage. Fortunately, I was able to send her to a physician who was able to open up her tubes. But then it made me think like, I don't really know enough about tubal occlusion and its impact on fertility. So I actually had reached out to a woman, an OBGYN, Dr. Kathleen Carlson, who I first met when she was a medical student. And like you, Haley, she was like, this is so cool, FACTS. Like, how can I learn more? How can I teach others? So she actually trained to be a FACTS speaker when she was a medical student. And she went on to do her OBGYN residency and then did the NAPRO fellowship. And now here she is, a practicing OBGYN. And I was like, do you want to come speak at our conference? So she's actually going to be coming to speak on the topic of tubal factor infertility. But for me, as like the co-founder of FACTS, like seeing this, very successful, accomplished OBGYN when I knew her when she was a medical student, it's so exciting to see the students that I've worked with in the last 5, 10, 15 years now out there actually literally physically changing people's lives. So, but I'm really looking forward to her talk on addressing tubal factor infertility. So
Yeah. Yeah. I am so excited for this conference. And I feel like little old me, non-doctor, is just going to be like, hello, everyone. Yes, I'm here to soak it all in. But no, I'm so excited for it. Tell us a little bit more about the conference too. I know you said Peoria, Illinois. When is it? Give us the dates.
Yeah, it's the FACTS conference. It's April 9th through the 11th in Peoria, Illinois. April 9th is actually pre-conferences, and we've got an incredible lineup of pre-conferences.
Yeah, you do.
So Katie Vidmar, who is a dear friend of mine, she does so much. I mentioned she and I are collaborating on this body literacy project. She's doing a pre-conference on Elevate training for body literacy. And this is really geared for those working with women and couples in crisis and, working with patient populations that may have really limited access to this kind of education. So that's going to be a wonderful presentation. She did it last year. We had like 30, 40 people. So it was a very popular workshop. So if I know you mentioned you worked at a resource center, like if you work at a pregnancy center, a lot of great information there. And then Melissa Buchan and Dr. Monica Minjur are going to be holding a workshop on neofertility medical training. Again, neofertility is one of the methods in which I'm trained. And FACTS is super excited. We're going to collaborate with neofertility to host another cohort training. So if you're interested, if you're not able to come to Peoria, but you want to get trained in neofertility, definitely reach out to us at FACTS at our info at FACTS About Fertility. And then our third pre-conference on Thursday evening is one with Ginny Nochi on balancing hormones through root cause nutrition. I know you got to meet Ginny last year when she did the speaker training, and
yes, and she's actually been on the podcast too, and she's all about functional medicine as well.
Yep.
So I'll actually link her podcast episode in the show notes because that was a really good conversation too.
That would be great. And we actually even have a virtual course on the foundational facts for fertility and whole body health because, a lot of times people will hear about our conferences, and while our target audience is the medical professional community, physicians, nurses, midwives, physical therapists, pharmacists, students, students, residents. We always welcome everyone that wants to learn more. And there is definitely something for everyone. But if you're brand new to this space or you feel like you'd like a good foundation, we actually do have a virtual pre-conference on the foundational facts for fertility. So really, really excited about that. So, and then Friday evening, we always do a dine around, which is great fun, where you get an opportunity to have dinner with the speaker in a small group setting. So people really like that. And Saturday morning, we have an amazing lineup of speakers. Have you ever read, I'll mention this because maybe some of your listeners have read the book, This Is Your Brain on Birth Control?
Oh, my word. I saw that you were having Dr. Sarah Hill speak.
Yeah.
And I think my heart skipped a beat. I am so excited. That book is phenomenal.
Isn't it?
I use statistics in that book all the time for
Yeah.
speaking engagements, everything. I mean, she's so good.
Yep. Yep.
She's great. I'm glad you're
And
having her there.
she just came out with another book, The Period Brain. And, one of the things we're really committed to in FACTS is making sure everything is really rooted in the science and the evidence. So we've already had our speakers submit their presentations. So I go through them like slide by slide. And when I was reviewing her slide, I'm like, I can't wait to hear this live. It's just really, really great information. So she's going to be speaking. Saturday morning's focus is really on mental health and informed decision making. So she's going to talk about women's hormones and mental health. Then we have Jamie Rachi, who's going to talk about accompaniment and just really accompanying women through mental health training and coaching and connecting. And then Dr. Annabeth Conley, who is with OSF, she's going to be talking about informed decision-making in women's healthcare. So really just a number of excellent topics on women's mental health and informed decision-making Saturday morning. Then for the first time this year on Saturday afternoon, we invited people to submit presentations to give. So we're going to be doing some breakout sessions. We actually have one on the pathophysiology of PCOS, so maybe your patient might like that. We also have an international speaker speaking on leveraging AI agents to discover FABM methods. So we're looking forward to that. Dr. Mike Manhart, who is actually on our FACTS board, he's going to be talking about optimizing skeletal health, right? Remember, I was talking about how progesterone is really important, not only for pregnancy, but also for bone health. And then Paula Gallagher, who works with us at FACTS, she is really the reason this conference is coming off so well. She also has her own infertility coaching business, and she's going to talk about inside the infertility journey, which will be awesome. And then we're going to do after those sessions, we're going to do a panel, a little bit of a Lincoln Stephen style debate with Dr. Gisela Valer Chavez and Dr. Joseph Davis. So Dr. Chavez is from Peru. Dr. Davis is from Florida. They're interesting because they're both OBGYNs who had done REI fellowships and had done IVF for many years until they realized that there really is a better way. And so they're going to be talking about anti-Müllerian hormone and how we can use this to inform our care. So we're really excited. And then we're going to close things out with a conversation on how do you put this into practice? What are ways that you can, successfully have a medical practice and use these methods in practice? So really it's going to be a great 2 days. So really excited that you're going to get to be with us, and really would love to see any of your listeners join us as well, especially if they're close enough to Peoria to join us in person.
Yeah, absolutely. Oh my gosh, you're giving this lineup, and I'm just amazed at the amount of knowledge and amount of brains that are going to be there, and I just get to soak it all in. I'm so excited. So yes, everyone listening, it is April 10th and 11th with the pre-conference day on April 9th in Peoria, Illinois. I will put the link to register in the show notes, and I hope to see you all there. Dr. Duane, before we end for the day, is there any other thoughts, comments, things that you wish the listeners to know?
Yeah, well, oftentimes the most common question I get about this conference is an amazing lineup. I don't think I can make it in person. Is there a virtual option? And I'm like, oh, I know it's so great. We don't actually live stream it virtually, but what we do is we record every single presentation and then we integrate it into our online learning opportunities. So we have continuing medical education courses, and we even have just sample our CME presentations for individuals, so I would definitely, if you can't make it in person, but you do want to check out some of the educational materials that we have, I invite you to sample our CME. If you do want to sign up to join us at the conference or sign up for our CME, I would definitely encourage people to consider becoming members of FACTS, because with that, you get a 20% discount on the conference or on CME. So it's well worth the investment. And then we invite you to be a part of our Community Connects events, which we do live via Zoom. It's always the third Wednesday of every month. So lots of opportunities to connect with some of these amazing speakers in real time, in a little bit more of an informal setting. And I'll just end with this. Our most recent Community Connects event, we welcome Dr. Joe Davis. I mentioned he'll be speaking at the conference on AMH. He is also going to be serving as our new fellowship director. And we're super excited. Like I said, we're getting ready to launch the fellowship this summer. And on Friday evening of the conference, we're going to have a wine and cheese reception and a little bit of a fireside chat with him to talk about him and his journey, right? How he went from working in New York City for IVF clinics, going to the World Health Organization where he served in the development of guidelines for infertility treatment, to serving on the ethics board for the American Society of Reproductive Medicine, to now being the director of the FACTS Fellowship and, offering real reproductive health care through his own integrative practice, Palm Integrative Fertility. So, yeah, I just want to say thank you, Haley. It's always a joy. And I would say if anybody wants a great FACTS speaker and they're located in the Southwest, you can submit a request and request Haley. She does an amazing job, but we've trained over 100 speakers all over the country. So no matter where you are, we can definitely find a speaker just to do at least that basic intro to FACTS, if you will. So
yeah. Dr. Duane, thank you so much for being on the podcast.
Thank you.